I want you to imagine for a minute that you're on a busy subway train and the police come on the train and try to tell a black man to get off. No blacks on the train. How do you feel? What kind of emotion do you respond with? Or if the police came on, tried to make a Jewish person get off. No Jews on the train. Get off. What about, let's say, the same busy subway train, and there's an older man, and he's standing, and he's weaving a bit, and suddenly he weaves and falls on the floor, motionless. What happens? Everybody moves towards him. A couple of people maybe who know CPR start checking his pulse, maybe performing CPR. Some are trying to talk to him. Sir, are you all right? Do you take any medication? They connect with him. They know what to do. And then someone calls 911. An ambulance arrives. The EMS comes with a stretcher, and they gently lift him up onto the stretcher, take him away, and everybody's worried about him. Somebody says, hope he's okay. We're all moved by that. Now I want you to imagine same age, older man is on the train, but instead of a physical crisis, he's having a mental health crisis. He's standing and he's agitated. He's talking to somebody who's not there. He sounds angry. Maybe he's moving his arm, stomping his feet. Do people go to him? No. They move away. Right? Somebody calls 911. But not for an ambulance. They're calling the police. And the police come on the train, and if he can't calm himself down, they'll take him off the train. If he still can't calm himself, they'll take him out of the station and up onto the street. And when he's gone, do people go, I hope he's okay? They say, whew, glad that's over. We don't think anything about that person. We don't connect with him at all. In fact, I'll wager that we would connect better if there was a stray dog on the train, right? So how does that happen? Well, don't feel too bad. It's because we don't know anything. We don't know anything about mental health. But don't feel bad because nobody knows anything about mental health. And to be honest, about 150 years ago, nobody knew anything about mental health or physical health. Say, at the time of the American Civil War, 1861 to 1865, it ended. So at that time, they didn't know anything about sanitary surgery, about sterile operating conditions. They hadn't discovered germs yet. So they hadn't discovered antibiotics. They didn't know anything about blood types, so they couldn't do any transfusions. They didn't know anything almost at all. In fact, it's estimated that out of over 600,000 soldiers who died during the American Civil War, about 1/3 of those died of disease and infection. Over 200,000. But since that time, there's been remarkable progress. In the area of disease, we have discovered the cause and vaccines for diseases like cholera, typhoid, bubonic plague, diphtheria, whooping cough, tuberculosis, tetanus, yellow fever, typhus, polio, measles, pneumonia, meningitis, smallpox, to name a few, right? We've discovered X-rays. We discovered blood types, so we can do blood transfusions. We discovered insulin. Previous to that, diabetes was a death sentence. Penicillin, of course, all kinds of antibiotics. Plus, we've discovered things like the cardiovascular system, the skeletal system, the nervous system, the immune system, the lymphatic system. I mean, and 100 other things that I'm not even touching on. Surgical techniques and technologies, and nothing short of miraculous in about 155 years. Now, during that same period, what have we learned about mental health? Nothing. Zip. Nada. Bupkis. We do not know one more thing today than we knew about mental health at the time of the Civil War 155 years ago. So, how did that happen? Well, it's hard to say exactly when it started or didn't start, but I have a theory that Sigmund Freud had something to do with it. Now, Sigmund Freud came not too long after the American Civil War, end of the 1800s. He was writing papers, and one of the most significant papers, I believe, that he wrote was one of his earlier ones, where he discovered, light years ahead of its time, that his hysterical female patients, he believed, were actually experiencing a kind of post-traumatic stress disorder related to sexual abuse that they'd experienced early in their lives from either from their father or a close family member, typically. Really groundbreaking. And he presented his paper at a conference, and crickets. I mean, nothing. Normally at those conferences, it was so dramatic. Normally, after somebody makes a presentation, they would produce a little synopsis and distribute it at the end of the things that the paper discussed. Freud had an empty box. So what had happened? Well, Freud was a little naive, I guess. Because when you have a paper that says that hysteria, mental health problems in the girls and women, hysteria is caused by sexual abuse by their fathers or other close family members, well, some of those fathers were probably in the room, and the ones that weren't were leaders of the community. They were heads of industry and government, and they heard this, and I'll tell you one thing, there was not going to be any theory that said that women's problems were due to sexual abuse by the father. That was not going to happen. So, somebody quietly came to Freud and said, hey man, either that theory goes or you do. And sure enough, the following year, Freud took this spectacular, light years ahead of its time theory and retracted it. Said, yeah, oops, made a mistake. So, Freud and others, whether they talked about it or not, discovered at that time something very significant. That it was a whole lot easier to tell people that bubonic plague was caused by a bacteria that was carried in fleas than to tell people that hysteria was caused by sexual abuse of a family member. So pretty quickly after that, we moved from trying to alleviate the suffering, the mental suffering of patients, to trying not to upset anybody. And so today, so there's a very different dynamic between, say, a physical health hospital and a mental health hospital. If I have a physical ailment, if I have a pain or a sickness, I go to the hospital, they run tests, they have a diagnosis, and then through medication or surgery, they find the cause of that pain or illness. They treat the pain or illness, and you leave the hospital healed or healing, normally. If you have a mental health problem, you go to the hospital. There's no test you can run, because we don't know what causes anything. So it would be the equivalent of going to a mental health hospital. Let's say, if we did the same types of things at a physical health hospital that we do at a mental health hospital. A patient would come in with a stomach pain. Doctor, I have a stomach pain. The doctor would say, well, you have stomachitis. Oh. Well, are there any tests that we could run? Well, we just did the test. You told me you had a stomach pain. I told you you had stomachitis. There. Oh. Well, what else? The doctor said, well, but don't worry. We're going to give you some medication. Oh. Is that going to heal my stomach? No. But it is going to make the symptoms go away so you don't feel like you have a stomach ache. And we're going to get you some talk therapy. Oh, talk therapy. What's that? Well, we're going to send you to talk to somebody because maybe you don't really have a stomach ache. Maybe you just think you have a stomach ache. Now, off you go. So, I am always amazed when I read that, say in Ontario or Canada, you see leaders in the mental health community go, we are the most qualified people to be guiding the future of mental health in Ontario or in Canada. And I'm thinking, how is that? In what way are you particularly qualified? Because according to your CV, the last 150 years demonstrate that you actually know nothing about mental health. So we should give you this job because of your demonstrable qualities in getting along with people? I would say not only should they not be guiding the future of mental health, I say we should go the other way. Anybody involved in the leadership or education of this failed system should be dismissed en masse, sent down, made to wear a red F on their chest for failure. We should be paraded through the streets like miscreants. People would jeer at them from the sidelines saying, shame, shame on you for letting millions of people suffer because you didn't want to make anybody mad. Maybe being outcast and ridiculed would give them more sympathy with their patients. And that is today's aha moment.